Hi friends, welcome back to the Bright Side of Beauty podcast, presented by Beyond Skin Aesthetics. I'm your host, Delaney, or as Instagram knows me, Delaney Danielle, or Skin by Delaney Danielle. I am super pumped for today's episode. It's a solo episode, so you are going to be getting a lot from me directly, and we're going to be talking about all things pregnancy, not just products. I know we touched on that in that would have been episode 5, I want to say, with my husband Mason, where we kind of dove into our story and announcing our pregnancy, as well as what products I'm personally using. Today, we're going to take it one step further, and we're going to be talking about what are kind of the do's and don'ts of pregnancy skincare and treatments, and what some good alternatives are for things that maybe you were doing before you got pregnant, but you need to consider alternatives now that you are pregnant. And you still want to be able to maintain those results that you've worked towards previously. You want to prevent things from happening. There's all sorts of crazy skin conditions that pop up when you are pregnant that you typically don't think about until you're in the thick of it, which I am. So I'm going to be talking a lot from my own personal experiences. I'm walking through the trenches currently, and things that maybe I haven't experienced yet, but maybe you've experienced in the process. So let's dive right in. Let's start off by talking about treatments, because that's something that we didn't touch on in the first episode talking about pregnancy and skincare. So with treatments, typically, we're using different modalities of things. So we might pair a laser with a chemical peel, or a laser with microneedling, RF microneedling, where you have that radio frequency side of things and you have that heat in the skin to help with skin tightening. We are addressing so many different things with the skin, full body with the skin as well. You might be doing body contouring treatments where, again, we're using that radio frequency. You may be doing laser hair removal on your whole body. Those are things to consider when you are pregnant that, again, like I mentioned in the first episode, nobody's going to test on a pregnant woman and an unborn child. If you are, typically it's going to be a product that is specifically for pregnancy that they're testing, and they've probably done some cancellations ahead of time before going into that clinical testing. It's very uncommon. So typically when it comes to like lasers and things along those lines, chemical peels, you're not going to use some crazy acid on a pregnant person that you know could cause damage. So keeping all of that in mind, these things, it's always important to check with your OB first, and it's always important to be going to a trusted provider that you know does their research and thinks through every possible scenario in a situation, because we are talking about your health, we're talking about the health of your baby, we're talking about ongoing problems that you could have post-care. So if we're thinking about like pigmentation, for example, there is a way to actually scar your skin when you're trying to treat pigmentation. So making sure that you really trust your provider and your provider is guiding you in a safe and efficacious direction as well as, you're doing these treatments. So rounding back again, if you're doing things like laser hair removal, you will want to put that on pause because, again, that's not something that has been tested. Some physicians are comfortable doing laser hair removal on different body parts that aren't necessarily close to your midsection. I personally take the approach of let's just put it on pause. Your hormones are going to be shifting anyways. There's no reason to even trudge into that territory if not necessary. Just put it on pause until after you have baby, after you're done breastfeeding. I hate to say it, but it does take a full 2 years for your hormones to balance back out after baby. And with laser hair removal, and when you're trying to get rid of that unwanted hair, you might go through all of your sessions right after baby even, and your hormones shift again, and you end up having to come back in for maintenance treatments. With laser hair removal, it is not permanent. It is just stagnating that hair growth. So with any sort of hormone disruption, you're going to have, that regrowth come back in. That's why we see a lot of women come in for laser hair removal, and it might be 10, 15 years down the road, and they're coming back in because they are now in menopause and they're having different areas of hair growth, or maybe that same area but their hair is coming back in a different way where they need treated again. So that's something to consider when, you're having laser hair removal or other treatments of that sort. Jumping to more of the skin tightening side of the equation. So with injectables, when you're thinking about like neurotoxins, which would be like your Botox, your Dysport, your Xeomin, your Jeuveau, you want to avoid those while pregnant. What are good alternatives for that? So glad that you guys have been asking, because that is one of the number one questions that we always get in office. My favorite alternatives would be Pep Up from Color Science. What Pep Up is doing is it is helping to plump up the skin in those areas and build collagen and elastin, which is going to smooth out the skin and help with the appearance of those stagnant fine lines and wrinkles. So your muscles are still going to be able to move, but it's going to help with, if your face is at resting, you're not going to have necessarily those deep stagnant lines around your crow's feet, around your forehead, around your smile lines, around your neck even. When we talk about tech neck, that's something very important to think about. We're all looking down all day long as we're typing on our computers, as we're typing on our phones, as we're, we get those necklace lines here. We want to be able to plump those up and reduce those fine lines and wrinkles from appearing. And during pregnancy, you can't necessarily use the injectable side of things with neurotoxins for that. So using a topical product like Pep Up is a great option for you. Another one that is a great option is Lines from Skin Better. And I do love this product. I love the Interfuse kind of product line from Skin Better. So you have Lines, you have face and neck, and then you also have Interfuse eye. And all of them are Spanx per se for your skin. They all have hyaluronic acid as their base. And when we talk about this, I'm going to talk about this a little bit later as well, as we're going through some of the things that happen to your skin during pregnancy. But when we're talking about hyaluronic acid, it's very important to remember that over-the-counter hyaluronic acids are typically paired with alcohol and other drying agents. So although you are locking in moisture topically, you're actually drying out your skin more by using some of those. So what these over-the-counter hyaluronic acids are typically a lighter weight molecule. We want a heavy hyaluronic acid weight so that it's able to really absorb into the skin. And typically with these higher weight molecules, they're not paired with things like alcohol. So we'll just go ahead and jump to the side here. HA Immerse from Elastin is my favorite hyaluronic acid on the market. And it is because it is anti-inflammatory in nature because of this exact thing. It's that heavy weight. It's going below the surface where it needs to go to actually correct the hydration in the skin. And that is same exact thing with the Skin Better Interfuse line of products. It is a hyaluronic base that's not paired with those aggravants, so not with alcohol and other things that are going to dry out the skin or cause aggravation. It is just going to give you that plumpness and that hydration in those different areas, and it's going to target those specific areas. So with Lines, for example, that is something that you can apply over your entire face. Traditionally, patients have focused more in the areas of concern. So for example, if I'm really concerned with my smile lines, and smile lines are one thing that I think are so beautiful because it just shows the joy in your life. But if it's something where you're feeling like, okay, those are really etched though, I like to smooth those out a little bit, where maybe you only see those when I'm actually smiling, not when my face is at rest. You could focus that right around your smile. If you're watching on YouTube right now or on Spotify, you can see where I'm giving examples. If not, use your imagination of where those lines would be when you smile. Another place that commonly we have areas of concern is your forehead, raising your eyebrows, or your WTF lines, that furrow. For me, when I smile or I'm very expressionate, I actually make little bunny lines on my nose, and I crinkle up my nose. I always have since I was little. There's actually some really cute pictures of me when I was like 3 to 5 range, where when I would smile, I'd wrinkle my nose, but it was just in this like pure joy laughter type way. And so those are lines that for me, I have those static lines. It's one of the only places that I do get static lines because I'm so expressionate through that area. But for me, I would use Interfuse line and really focus in on those areas. When it comes to face and neck, that is an all over product that you can use to really plump up and firm everything. That is something that I really like to utilize, not as an alternative to neurotoxin or as an aid to neurotoxin. When you're thinking about an alternative for like your Botox and your Dysport, focusing on lines specifically, interfused lines from Skin Better is going to be your best bet. Face and neck is going to be more for that firming effect. So if you feel like you have droopiness in your skin and you want to kind of pull everything back up, that's like your facelift in a bottle versus your Botox in a bottle per se. And then interfused eyes is going to be great for, especially if you are concerned most with your crow's feet. I think that number one concern for women is more of their forehead area and those expressionate lines. Number two is around the eyes. The number one thing that we see patients coming in for, and this is on a national standard, this is not just for our practice at Beyond Skin Aesthetics, is patients walking in the door asking about concerns with their eyes, whether that be their crow's feet or dark circles. And so when you're not able to use neurotoxins to relax those muscles and help with those static lines around your eyes, that's something that you want to be thinking of. So I would say on the pregnancy side of things, Pep Up is going to be my number one product of recommendation when it comes to an alternative for Botox, Dysport, Xeomin, Jeuveau, whatever you may be using at home, or not at home, but getting injected. And that's like your preferred product of choice at you, wherever you may be nationally. I don't know why I said at home, because I know some of my listeners aren't in Columbus and coming to us where we focus mainly on the Botox and the Dysport side of things. But whatever your product of choice may be on the neurotoxin scale, I would say a good alternative for that would be Pep Up. Number one, that's going to be great for all over face, neck, anywhere that you feel like you have those fine lines and wrinkles forming. Second best is going to be lines from Skin Better and interfuse eye from Skin Better, and focusing specifically on those areas concerned, whether it be your forehead, around your what we would call nasal labial folds, or marionette lines. And you could focus lines around your eyes as well, but interfused eye is going to be more for that eye area. Okay, jumping along as well would be for your dermal filler side of things. So if you are somebody that likes to get dermal filler in your lips, guess what? During pregnancy, your lips swell. So you're going to feel like you have lip filler, and it's going to be amazing. I feel like I just got fresh lip filler, which I did technically a couple of months ago before I found out that I was pregnant, actually right before I became pregnant. But I feel like I just got lip filler like a month ago, because my lips are a little bit more plump and full, and they do look more hydrated. I also kind of cheat code my way through that hydration side of things though, because I'm using HA Immerse across my lips too, which again, we'll get into deeper when we talk about the dry skin side of things. But when it comes to dermal filler, if you are somebody that likes to get your lips done, you like the chin filler, you like jaw, you get your cheeks done, honestly, your face is going to hold on to more fluid when you are pregnant, especially if you have different concerns, such as preeclampsia. You're going to hold on to fluid. It just is what it is. Even if you don't, even if you have a very healthy pregnancy, especially by the end of your pregnancy, you're going to feel a lot fuller in those areas. But if that is an area of concern for you today, and you are not able to get your treatments and you want to get alternative for it, again, going back to Pep Up from Color Science, it's going to pep up your skin. It's going to help to plump out those fine lines and wrinkles. But on a sidebar, I actually really like Restorative Skin Complex from Elastin. What Restorative Skin Complex is doing is attracting to that hydration in your skin. So obviously the more hydrated, the better with that. And that is internal hydration, not necessarily just, in that outer epidermal layer of hydration, but, are you drinking enough water? Are you staying hydrated side of things? It's going to attract to that, hydration in different areas of your skin, and it's going to help to plump those up. So, if you do have filler, that is something that has been, I would say, an adverse reaction of Restore Skin Complex that we have seen. I know Katie may have talked with some of you, if you're one of our patients, about this, where she had gotten some under eye filler, and that Restore Skin Complex actually plumped up her under eye filler, so she noticed it a little bit more. That is honestly not very common at all. She's just our delicate flower that always has reactions to everything. But when you think about how that science works, that makes sense that if you do want to plump up your cheeks and you do have more hydration because you're holding on to fluid in your face, Restore Skin Complex is going to help to give you that healthy, balanced plump, not that overfilled plump to things. So definitely don't be afraid to use Restore Skin Complex if you do have fillers. It's a gorgeous balance that helps to bring the fullness back to your skin, not over exaggerated. Honestly, I probably should not have even just told you about Katie's experience, but we are all here about transparency, and let's be real. I overshare because I care. So I'm always going to tell you guys the best and the worst of anything. Even if it's something that I really, really love, I'm going to tell you the opposite side of it as well. So Restore Skin Complex, great option for that. Pep Up, great option for that as well. Okay, so what happens to your skin when you are pregnant? Well, it stretches, gets very dry, and sometimes you can end up with what's called a pregnancy mask and you're dealing with pigmentation. So what do you do about all those things? Oh, and another thing that nobody freaking talks about, other than I feel like everybody says, if you're having a girl, they steal your beauty, so you're going to break out. If you're having a boy, you don't have to worry about it. Newsflash, I'm having a boy and I'm so broken out all the time. And it is not necessarily cystic acne, but it is like these little tiny rolling congestion spots all over my face, all over my arms, all over my legs. Like, it is just annoying. What is causing that? Well, friends, I am really sad to tell you, sometimes that comes from constipation, and that is something that you're going to deal with in pregnancy. When you think about acne in general, we do talk about making sure that your gut is nice and balanced and that you are going to the bathroom at least once a day. Our goal is twice a day. We talk about that with all of our wellness patients in general. So whether you're on one of our medical weight loss programs, you're dealing with, our functional medicine program, and we're balancing out your entire body, and we're looking at your hormones and your different levels and just how your body is functioning to make sure that it's functioning at its very best. When you're pregnant, that adjusts. Again, I overshare because I care, so I'm going to tell you a little bit about those changes for me personally. But with pregnancy, pre-pregnancy, I actually teetered on the line of what Dr. Malumpa would honestly deem and diagnose as IBS. I had no issue with regularity whatsoever. And it was almost to the point where I wasn't necessarily always absorbing my nutrients because of that. But with pregnancy, I'm now on the opposite side of the spectrum. It's something I've never dealt with before. I've had to start to learn how to deal with that constipation side of things. And you can't necessarily use all the tools that you could if you weren't pregnant, because again, a lot of things aren't necessarily tested. But what happens when we get so backed up? Those toxins have to come out somehow. They just do. So sometimes those breakouts may not just be from the hormones. A lot of times they're from the hormones, but sometimes they're not. Sometimes it's from an imbalance in your body where your body is holding on to all of that waste that it needs to get rid of, or you're just gut imbalanced in general that's been thrown for a loop and is completely different than before. Some people say that when you get pregnant, your body will basically heal itself and everything will get better. And like I said in my episode with Mason, he was so sweet. And one of the first things he said when I got pregnant is, well, now we're going to see if your rosacea corrects itself. And it's not something that you necessarily have to deal with while you're pregnant. And in my case, it was the opposite. It's been very flared up, but it's been flared up because of these other triggers and things. And with that comes your papules, your pustules, your acne breakouts that are happening. So that is definitely something that when you're pregnant, you may deal with those breakouts. And how are you going to treat those breakouts when you are pregnant, because again, you have to be very selective of the products and the ingredients that you're using, the different procedures that you're having done. So from a treatment side of things, I would say my number one treatment that I love for my mamas that are coming in, pre-having baby, post-having baby, throughout the entire process. I shout out to my patient and my friend Bree. She actually came in to see me. She was so dilated that she was like, my water may break while I'm here with you getting my facial today. But I love doing Diamond Glow facials on my mamas right before they go into labor, because you're going to have all those benefits going into it, and you're not going to want to have on makeup. You're not going to want to have on like a full beat and all of that. But you're going to feel so much more put together and just relaxed and prepared for this journey that you're going on. And, the battle that your body is about to go through, but also the beauty of what your body is capable of. You are just pampering it and loving on it and able to let your body do its thing when you come in for that. So I love Diamond Glows for my mamas because it is going to exfoliate your skin. It's going to help with all that dead, dry skin, all that excess that's having, trouble turning over. We're going to be able to get rid of all that. It's going to extract any of that grossness and that gunk that's trapped below the surface. This is great for hormonal acne. This is great for if your body is trying to basically get rid of waste any way possible and you're having some kind of flare up because of that side of things. And then at the same time, it's going to infuse a treatment serum that's going to stay in your skin for over 72 hours post your treatment as well. And I say 72 hours, I know that's very specific, friends, but that's what the clinical study was for 72 hours. And at that point, it was still 100% active in the skin. So using our deductive reasoning, we know that that serum is continuing to work past that 72-hour mark 100%. So that facial, that serum is continuing to treat your skin way after we're done, treating your skin. So I tell my patients you can expect improvement in your skin over the next 2 weeks. Typically with a Diamond Glow, one of the, downsides of it is because it is pulling all that gunk out from below the surface of your skin. Sometimes we have those breakouts that are below the surface that we don't know are there yet. You know what I'm talking about? Like, have you ever felt a pimple and you're like, okay, everything's smooth, but I just know I'm going to have one there. Like I can just feel it coming. I'm going to have a breakout in this specific spot. And it's almost sort of the touch. It's kind of that concept. So sometimes we may not even be able to feel the congestion in those spots. What a Diamond Glow is doing is pulling all that out. So you might have very, short-lived breakouts that come from a Diamond Glow treatment as it's pulling out. Typically, these are only 2-3 days of healing because it is pulling everything out. So it's just your body healing from what was trapped below the surface in that case. So Diamond Glows are my number one thing that I love, 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 love to do for my pregnant mamas. On a more relaxing side of things is a Glow 2 facial. So this is using that patented oxfoliation technology where it's oxygen infusion, and that oxygen infusion is causing little CO2 bubbles, which is actually the CO2 bubbles it's what is causing the oxygen down in your skin. And that is what is causing the sloughing and that turnover. It's very gentle. You don't necessarily feel that as it's happening. It's not like a peeling situation necessarily with most of they do have one specific pod that we can use that may cause a peel, but for, their baseline ones, they have one for hydration. They have one to give you a glow. They have one for anti-aging. They have one for luminosity. I mean, they have a pod for almost everything. And with that, I have a lot of mamas that absolutely love, love, love the Glow 2. That's actually my mom's favorite. And, that's obviously she's 28 years post-baby at this point, but she loves it because it is so relaxing. And that is why my pregnant mamas and my, right after birth, Mamas coming in really love it because it is so relaxing. It's not necessarily just that satisfying side of facial, but it feels like what I would call a frou-frou facial with those medical results. So it starts with that exfoliation side of things. And then the side that I like to have my patients double check with their OBs with is it does use a very low grade ultrasonic technology to basically shimmy and shake the treatment serum into your skin. This isn't going to be the same type of ultrasound as, we're seeing at your doctor's office or that you're seeing on other devices that is going down so deep that it's of concern. This is very just epidermal layer type ultrasonic infusion of these serums. But because it is ultrasound, I like my mamas to check in with their OBs ahead of time for that, just to get the thumbs up. And, typically you're going for your appointment every 4 weeks. So if I see a mama at one appointment and we have them scheduled out for 4 weeks, they typically are going to see their OB in that time frame. So we just hold off. We might start with the Diamond Glow and then maybe try that Glow 2 the next time that they come in. The last part of that Glow 2 facial is actually a massage. And this is why it is Kim Poor's very favorite thing on the planet is you are getting this very low vibrational lymphatic massage. It is so relaxing. I typically will up this time. So by standard, it's between 5 and 7 minutes. I typically will actually up this to closer to like 10 to 12 minutes in my treatment room because that is my patient's favorite part of it. And as long as a provider, you're following that lymphatic drainage kind of pathways and systems so that you know that it's safe for your patient to be giving them the lymphatic massage for that long. I mean, you go to a massage therapist and you have an hour-long massage. So it's just important that you are trained on lymphatic massage before you are doing this for such an extended period of time. But it is glorious. It's also glorious for my mamas that are holding on to fluid in their face to help with that lymphatic drainage because typically that is where that imbalance is happening and why you are really locking in that water tension in your face, in your hands, in your legs. It's from, you need to stimulate your lymphatic drainage in that case so that your body can process that all off. So it's a great one for my mamas that are struggling more with the swelling and they don't like the swelling side of it. Jumping now towards, I would guess, more of the serious treatment sides. One of the other most asked questions, number one, is what can I do because I can't get my Botox for a year now? Number two is, okay, but I love microneedling. Can I do microneedling while I'm pregnant? This is a yes and a no. So with microneedling, typically you're numbing the skin. In our office, we actually have a couple of different topical numbing agents so that we do have a pregnancy-safe numbing agent. Check with your OB. Always check with your OB. We're going to keep going back to check with your OB for this. But with those topical numbing agents, as long as you're using one that is safe, there's no reason that you can't, use a topical numbing agent for microneedling. There are so many different types of microneedling on the market these days. So we're not just talking our standard needling at this point. We have PRP, PRF. We have growth factors that can be infused in the skin with microneedling. We have RF microneedling. I mean, the options are endless for needling your skin. You want to avoid things like RF microneedling, but standard microneedling, there's no reason that you can't do it. I would expect for longer downtime with that. So if you're somebody that already has extended downtime, that may be something that you want to talk to your provider about of, is it a good option and is it something that you're okay with? For example, with standard microneedling, typically downtime is, we'll say 48 hours just to be safe, that you feel like you have a sunburn. That first 24 hours, you can feel really beet red, tomato red. And then after that, it, starts to die down a little bit more where it just feels like a sunburn with it. With pregnancy, your body is healing at a little bit slower of a rate because, again, it's running a marathon for basically 9 to 10 months straight as it's building a little human. So your body is going to be way more focused on building a little arm or a leg than it is going to be healing topically your skin. It's priorities, okay, ladies? priorities. Baby comes first. Your body is going to be feeding the baby first. It's going to be making sure that the baby has everything it needs, healing anything that needs healed, building those different parts and growing the different organs. And it's just miraculous. But the focus is not on whether or not you feel like you have a sunburn with your microneedling treatment. It is what it is. So with that, I would expect a little bit longer of downtime with those treatments, but we can absolutely do microneedling. For those that are concerned with pigmentation specifically, and they maybe have been treating their skin with my favorite combination, which is the Airlace Neo, and which has no downtime to it whatsoever, but it is a laser. And then following it right up with a chemical peel, whether that is in our office, we love to utilize the VI peel or the Milano peel and have multiples of treatments. I've gotten some of the best results pairing Airlace and the Milano peel together for hyperpigmentation, melasma, etc. Even during the summertime, I've gotten some fantastic results. This is a modality you want to avoid during pregnancy. So microneedling could be a great option for you. I would say if you're dealing with pigmentation, I know it sucks. I know it does. Using a tyrosinase inhibitor from the get-go of your pregnancy is going to be the best thing that you can do. What is a tyrosinase inhibitor? We touched on this a little bit during the first episode talking about pregnancy and products that I'm using right now. My favorite one is Illuminate. So what's a tyrosinase inhibitor? Basically what this type of product is doing is it's turning off the lights on your pigmentation. So where we'll use the analogy of where, we all have melanocytes all over our body. It's what gives us our specific complexion. So whether you are more melanin rich or you're more fair skinned, that is your body's natural melanin production. In certain spots where melasma typically are flaring, we have an imbalance of those melanocytes being produced and basically firing off at a time. So what a melanocyte inhibitor or tyrosinase inhibitor is doing is it's helping to balance out the production. So it's not necessarily bleaching your skin. We're not going to have any sort of like craziness happening in that sense. It's just putting your skin functioning at that melanocyte level exactly where it's supposed to be at. So using that product from the get-go is going to be the best at preventing any sort of melasma flare-up. But if you haven't been using one and you start to deal with that pregnancy mask popping up, it's never too late to start. And a lot of tyrosinase inhibitors, like I mentioned, my favorite one is Illuminate from Elastin. Illuminate from Elastin, you're going to start seeing results in just one bottle. So that can start your process of basically treating at home in a pregnancy safe way for that melasma. And then as soon as we're able to, you can absolutely, while you are breastfeeding, get a laser done or get certain chemical peels done. So that's something that maybe we want to wait until right after you have baby. But with that pregnancy mask, your hormones are balancing out over the next 2 years. And that's unfortunately a hormonal flare of melasma. So triggers for melasma and that pigmentation could be heat, could be, spicy things, could be hormonal. This specifically is that hormonal flare. So treating right after you have baby, you might have some fluctuation in that pigmentation that occurs. So that's something that we want to, stay ahead of. And best suggestion is using a tyrosinase inhibitor religiously throughout the entire process so that you're preventing and you're treating without having to invest the money in, in-office treatments necessarily. But in-office treatments are always an option. It is never too early. It is never too late. It just, your provider will walk through when the best time to invest in an in-office treatment is for you when dealing with melasma. Okay, so we talked about breakouts. We talked about the pregnancy mask. We talked about what to do if you feel like your fine lines and wrinkles are out of control because you can't do your normal routine. The other thing that happens, and I've alluded to this throughout the entire episode at this point, is your skin gets so dry. And why I did not know this ahead of time, I don't know. I have dedicated so many years to educating myself on skin conditions, different phases in life, our approach at BSA is definitely functional aesthetics and, using functional medicine to our aesthetic aid. And why I did not know that, I guess, to the level that your skin dries out. I knew your skin dried out. I just was unaware of the absolutely depth of the dryness that occurs and those flares that can happen. So I have absolutely been a lover of HA Immerse for forever at this point, basically since it came out, because to me, it's like a swimming pool for your face. But in pregnancy, it has been a non-negotiable for me. And how I apply it is I apply it, honestly, 2 pumps is the normal kind of level of it. I have been doing 4 pumps morning and night. Yes, it is pricey, but it has been necessary. I put it all over my face and my neck. And as I'm doing it, so as I'm doing my face, I wipe my whole face and then I take a hand and I swipe it straight over my lips. And that is how my lips are staying so hydrated right now. Because even though your lips are plumping up and they look more hydrated, they are so flaky and dry. It is the craziest thing that happens. Again, your body is focusing on building this little human. It is not focused on whether your lips look hydrated and juicy or not. So you're going to need to do the work on the side. So using HA Immerse, that is my hack, is putting HA Immerse over top of your lips as well. Think of it as a lip treatment in the morning and the night as you go. Of course, use your lip treatment throughout the day too, your normal lip gloss and peptides that are going to help to hydrate. But having that morning and night has been a game changer. As soon as I started implementing that again into my routine at the beginning of my pregnancy, I was kind of just in this place of, oh my gosh, I can't believe I'm so dry. And once I started doing that as well, and I was upping my amounts and making sure that really like tip to tits is what they say. It's really the tip of your head all the way down to the middle of your chest here. You're going to want to really soak in whatever you are using. And honestly, your chest is going to be one of the first things that show aging anyways, so you should be doing that in regular practice. But when you are pregnant, do not miss it. I promise you will be so much happier if you just treat all of it and you feel nice and hydrated as you go. We're all focused on our bellies and making sure that we are preventing stretch marks to the best of our abilities. That needs to carry on to other parts of our bodies as well. It's a comfort thing. Think about like how itchy your skin gets when you're pregnant, especially later in pregnancy. It's hydration. Not only is it good for your skin, but it's good for your mental health. It's relaxing as you go. So this part is my biggest tips for my mamas out there, especially those that are currently pregnant. And I actually learned part of this tip from my chiropractor. Shout out Tyler, the chiropractor, on Instagram. He's in Gahanna. He is very close to our office, about 7 minutes from our office. He's like in the New Albany, Gahanna range-ish there. Potent chiropractic. But he taught me a trick for how to get through some of those pregnancy pains in my body. I'm applying that to also how I'm applying my products to my abdomen area as my belly is growing a little bit more. So let's first talk about what products I'm using. I'm using Transform, or right now I'm using Transform because I got some travels of it. So I'm finishing up my travels with it. They were in a goodie bag from Aesthetic Next, and I just love Transform so much. But I'm either using Transform or Reform and Repair from Elastin. I opt for Reform and Repair because it's all the benefits of Transform, but you're also getting arnica on such a high level. It's so healing for your skin. So Reform and Repair was really developed for post-plastic surgery or post-surgery to help with the scarring. And the way that I think about it is you never know what's going to happen when you go in for labor and delivery. And for me, although I'm not necessarily planning, knock on wood, for a C-section, I want my body to be prepared to the best of its ability in that case. I want to be prepared for whatever outcome may come, just so that baby and I are as safe and happy and healthy as possible. So I'm opting for Reform and Repair because it's going to give me all the benefits of Transform, of, that that hydration side of things, helping to stretch the skin in a very healthy way, / helping to pull the skin back together so that it's not as lax. It's going to be kind of like the rubber band in your skincare to make sure that your skin is able to expand when it needs to, but it's going to snap right back when it's time as well. And then also having that healing component where it's using that Tri-Hex technology, turning over the collagen elastin, strengthening your skin up so that if in the case I do have any sort of incisions to my abdomen, my skin is prepared for it and I have very minimal scarring in the process. The other thing that a product like that is doing is it's helping with stretch marks. So when you think about what stretch marks are and the scars that stretch marks are, that is the same thing that we are kind of pre-treating for with something like your, surgical scars in a way. That's at least how my brain works around it when you're thinking about how to heal the skin and get the skin to operate at its peak ability. Taking that functional aesthetic approach of how to get your cells to function to their best of the ability, that's the way to do it. Use something in that sense. So I start off with either Transform or Reform and Repair on my abdomen. When I'm done with that, I use Lipid Body from Epicutis. I also love that. That is kind of duped as Botox in a bottle for your body. So I love to use that over top as well. And what I do when I am applying this is I apply it in upward motion. So this is what Tyler has basically taught me, especially as, and again, those that are watching on video, especially as this area here is starting to stretch out, you want to make sure that you are treating that and you're helping to kind of massage that. And that's where a lot of the cramping comes from. So when I'm applying, I will apply in this upward, almost like a cat petting motion all the way across my abdomen. And I'll do that up as well, but really focusing on, my lower abdomen area as that is expanding. And that's where for me so far as my bump is kind of forming, I am getting the most tightness, muscle tightness with that. So it's helping to rub out that motion at the same time as you're really getting it in there with your skincare. So that is kind of the best thing there. I thought that this was going to be a short episode and man, I never surprise myself. Actually, I always surprise myself in how long I can talk about different topics. So we are going to wrap this episode up at this point. I could go on and on and on about different things, but I want to highlight a couple of different products that I've mentioned just to summarize everything. So as a good alternative for your Botox and for your Dysport and your filler, using Pep Up from Color Science or the Interfuse line, specifically Interfuse Lines and Interfuse Eye from Skin Better. Great options for that. If you are looking to plump up your skin because you're just feeling like you're sagging and dragging, Restorative Skin Complex and Pep Up. Restorative Skin Complex from Elastin and then Pep Up from Color Science are going to be your best options there. Hydration side of things, using HA Immerse. Something I didn't mention is I love the Barrier Pro Duo from Color Science as just kind of my baseline cleanser and moisturizer. If you're only going to be able to use 2 products, I'd mentioned this in the last episode, that's going to be your lazy girl routine to make sure that you are giving your skin the most possible while doing the least amount of steps. So especially if you are sick and it is just a pain to try to do any of these things. I know these are a lot of products. Focus on those 2. The Barrier Pro moisturizer is fantastic. Another one that kind of is a step up on the hydration feeling side of things. So they're both giving you amazing hydration, but sometimes it just feels nicer to have a little bit thicker of a moisturizer. I love Ultralight Moisturizer from Elastin as well as Ultra Nourishing Moisturizer from Elastin. I will tell my patients to use Ultralight during the summer, Ultra Nourishing during the winter, but really it has to do more with your skin type. So if you are very dry in nature or during pregnancy, Ultra Nourishing is going to be a great option for you. If you are naturally oily or pretty balanced, I would stick with Ultralight. Ultra Nourishing is just going to be a little bit too heavy for you in that process. So HA Immerse for your hydration all over, Ultralight or Ultra Nourishing from Elastin. Those are all going to be great products for that hydration side of things. If you are breaking out, I love the new refining foaming cleanser from Skin Better. We actually do not carry it in our office quite yet, but they sent me a PR box and I've been able to try it, and it has been a game changer for when I do have more of like the really bad breakouts, but more for the breakout side of things, focusing on balancing out your skin. So going back to that Barrier Pro duo in that process of the cleanser and the moisturizer, it's going to be balancing out your skin. And then a Diamond Glow treatment wise. If you are looking for skin tightening, or you are dealing with melasma already and you just can't wait to deal with, it post baby, microneedling is absolutely still on the table for you. Start a tyrosinase inhibitor for no matter what. Just start a tyrosinase inhibitor. Even if you haven't had a history of pigmentation in the past, you never know what is going to flare up that pigmentation, and it is such a battle to get rid of. Just do yourself a favor. Start a tyrosinase inhibitor ahead of time. Illuminate is my favorite personally. Our patients have also had great results with Bright Alive from Zio, as well as Even Tone from Skin Better. If I had to kind of put them in order of my favorites, that's the order I would put them in. I always say Illuminate because I know at the end of one bottle, you're going to have results. I trust it. I've tried it myself. I've tried it. So many of my patients have shown those results of it. I've researched into the clinical studies of things as well. I trust Illuminate full-heartedly. So that is going to be my favorite tyrosinase inhibitor. Next is going to be Bright Alive from Zio. Next is going to be Even Tone from Skin Better. All great products. I just have my tried and true that I really trust. That I believe. And then let's see, actually body. Just to recap again, Transform from Elastin, Reform and Repair is my favorite one to use on my belly. And then Lipid Body from Epicutis. Those are going to be the body products to use as well. So if you have any other questions when it comes to pregnancy skincare and what the do's and don'ts are, please send them my way on Instagram. We can do kind of a day and I can make a highlight bubble where y'all can drop your questions and then I can save them onto my profile. You can also drop them in the comments here on YouTube as well. And I will see you all real soon. Have a bright and beautiful day.